Namaskar. Welcome to my YouTube channel. Today we are going to discuss about Aiims Staff Nurse Previous Year Question Paper Part 8. Let's start. The first question. Identify the conjugate measured in the picture. Option A. Obstetric conjugates. Option B. Diagonal conjugate. Option C. True conjugate. Option D. None of the above. The correct option is option A. Obstetrics conjugate. Onset of puberty before the age of 8 years in girls is called dash. Option A. Thelarge. Option B. Menarche. Option C. Delayed puberty. Option D. Precocious puberty. The correct option is option D. Precocious puberty. Glutaraldehyde is used widely as a cold sterilant to disinfect a variety of heat-sensitive instruments. Give the example. Option A. Forceps. Option B. Scissors. Option C. Laparoscopic instruments. Option D. Patient bed. The correct option is option C. Laparoscopic instruments. What room temperature should be maintained during the period of phototherapy? Option A. 24 to 26 degrees Celsius. Option B. 30 to 32 degrees Celsius. Option C. 28 to 30 degrees Celsius. Option D. 26 to 28 degrees Celsius. The correct option is option C. 28 to 30 degrees Celsius. Choose the correct statement regarding ECG changes in hyperkalemia. Option A. Peak P wave, AC depletion, shallow T wave, and prominent U wave. Option B. Flat P wave, prolonged PR interval, widened QRS complex, and tall T wave. Option C. Normal P wave and QRS complex, rounded T wave, and shallow U wave. Option D. Peak P wave, absent QRS complex, and prominent U wave. The correct option is option B. Flat P wave, prolonged PR interval, widened QRS complex, and tall T wave. To perform catheterization, the nurse should place a woman in option A. Lithotomy position, option B. Dorsal recumbent position, option C. Sims position, option D. Tendelberg position. The correct option is option B. Dorsal recumbent position. Stunting refers to option A. Low weight than what is appropriate for a certain height, option B. Low BMI, option C. Low weight than what is appropriate for a certain age, option D. Low height than what is appropriate for a certain age. The correct option is option D. Low height than what is appropriate for a certain age. What are the characteristic findings with regards to CSF after a lumbar puncture is performed on a child who has bacterial meningitis? Option A. CSF is cloudy, elevated neutrophils, elevated proteins, decreased glucose. Option B. CSF is clear, decreased pressure, decreased protein, and increased glucose. Option C. CSF is clear, decreased neutrophils, increased protein, decreased glucose. Option D. CSF is cloudy, increased pressure, decreased protein, increased glucose. The correct option is option A. CSF is cloudy, elevated neutrophils, elevated proteins, decreased glucose. What is trimester-wise weight gain in pregnancy? Option A. 152 kg. Option B. 525 kg. Option C. 155 kg. Option D. 555 kg. The correct option is option C. 155 kg. The common normal site of implantation of blastocyte in the uterus is option A. Upper uterine portion, option B. Mid uterine area, option C. Lower uterine area, option D. Lower cervical segment. The correct option is option A. Upper uterine portion. The relationship between the fetal presenting part and maternal pelvis is known as option A. Attitude, Option B, lie. Option C, position. Option D, station. The correct option is option C, position. Which vaccine can be frozen? Option A, BCG. Option B, polio. Option C, MMR. Option D, DPT or DT. The correct option is option C, MMR. Which vaccine given to forms blisters and heals by itself and form permanent scar mark after administration is? Option A, BCG. Option B, MMR. Option C, DPT or DT. Option D, polio. The correct option is option A, BCG. A post-LSCS woman poses 400 ml urine in past 24 hours. Option A, oliguria. Option B, polyuria. Option C, anuria. Option D, hematuria. The correct option is option A, oliguria. Red color urine is caused by which anti-tubercle drug? Option A, isoniazid. Option B, rifampicin. Option C, streptomycin. Option D, none of the above. The correct option is option B, rifampicin. Visualization of bone in which stage of burn? Option A, first stage. Option B, second stage. Option C, third stage. Option D, fourth stage. The correct option is option D, fourth stage. What will you do if you have a needle stick injury of a HIV patient? Option A, give incision to the injury. Option B, suck out the blood. Option C, squeeze out the blood. Option D, wash with soap and water. The correct option is option D, wash with soap and water. Identify the procedure being performed in the image. Option A, blood sampling for ABG analysis. Option B, IV drug administration. Option C, venipuncture. Option D, all of the above. The correct option is option A, blood sampling for ABG analysis. A 28-year-old Primigavita comes to the ANC OPD. How many additional kilocalorie will you recommend it? Option A, 200 kilocalorie. Option B, 300 kilocalorie. Option C, 500 kilocalorie. Option D, 1000 kilocalorie. The correct option is option B, 300 kilocalorie. Which is the most appropriate nursing action for a 32 years female patient diagnosed with bipolar affective disorder? Option A, use physical restraints. Option B, establish clear boundaries. Option C, use chemical restraints. Option D, give ECT. The correct option is option B, establish clear boundaries. Please like and subscribe. Thank you.